Hello, everybody. This is Dr. Gregg Hanzlicek from the Kansas State Veterinary Diagnostic Laboratory in the College of Veterinary Medicine at Kansas State University. Thought I'd take a little bit of time to talk about hypomagnesemia in beef cows. And one of the things that we have to understand is that cattle, although they can store large amounts of magnesium in their bone and teeth, they really have no practical, effective way of mobilizing that magnesium. And so they are dependent on their dietary intake and absorption of magnesium on a day-to-day basis in order to meet their magnesium needs. One of the things we see in hypomagnesemia is grass tetany, and these will be cows that are on very rapidly growing lush pasture. And what's happening here is that these grasses are very, very high in potassium, and potassium prevents the active absorption of magnesium through the rumen wall. The other thing that's going on is in the grasses, they're low in sodium and chloride, and those two minerals are very important for the active absorption through the rumen wall also. Other thing is that cows, as they age, are less able to absorb magnesium, and so that's typically why we see hypomagnesemia in the older animals. And then because they're on a very lush pasture, lush forage base, the rate of passage out the rumen is very, very quick. Rumen retention time is low, and therefore there's not enough time to digest and absorb the magnesium that's contained in the forages before they pass out of the rumen. The other time that we see hypomagnesemia is in the winter in adult beef cows that are just before or just after calving. And some of the risk factors for that or contributors are the dietary magnesium level. Sometimes we have unbalanced diets, or our forages aren't tested before we feed them. Again, just like the grass issue, we have aged animals are less able to absorb the magnesium. And then a little bit different than what happens in the pasture is that animals on this high forage diet, that actually increases the rumen pH. And as the rumen pH increases, the solubility of the magnesium decreases, and therefore we don't, our absorption out of the rumen is less. And then just like the pasture issue with hypomagnesemia, we've got excessive dietary potassium, and sometimes we forget to put salt out, or the cattle run out of it, or they don't eat the salt, but we have a deficiency in sodium and chloride. The last thing that, or one of the last things that can contribute to this winter tetany issue is the form of the magnesium oxide that's in the mineral. Magnesium oxides are the primary form of magnesium that we put in minerals, and we know that if they're not finely ground, that their solubility in the rumen is much less, and therefore their absorption is less also. So all those things, one or more, can be contributing to winter dysentery in our beef cows. Just wanted to show you a really good study that had some negative controls where they purposely fed lactating cows magnesium deficient diets, and the vertical axis are serum magnesium levels, and the horizontal axis are the days post treatment, and the treatment would be difference in diets. And this is just looking at day 11 through day 26 of the study. Day 11 is when the animals, represented by the gray line here, were put on a magnesium deficient diet. And so they are put on day 11. You can see very rapidly their serum magnesium levels decrease very, very quickly. With just in a day or two, it was measurable. The other thing to notice is that these green arrows represent animals that became clinical hypomagnesemic animals. And the first one actually became clinical a day later, a day after being on the deficient diet, another one day 14. But this animal didn't show clinical signs until day 22, and this one at 26. And on day 26, even though these animals were on a severely magnesium deficient diet, 6 of these animals, 6 out of the 10 on the diet, were actually clinically normal. Their serum levels were low, but they were clinically normal. How do we assess magnesium in a herd? In a couple ways to do it. We can take urine. Urine is a good magnesium sample, but typically and practically we're going to use serum. All it requires is to take 12 to 15 serum samples from animals, cows that are close to calving, either just before or just after. And if 20% of those animals have levels less than 1.9 milligrams per deciliter, that gives us a really good idea that we might have a clinical and a subclinical hypomagnesiemic issue in the herd. Postmortem analysis, a little bit more controversial. Samples, again, urine. If the urine is there, that's a good sample. But we can use aqueous and vitreous humor for those animals that are deceased. And this table here to show that there are different concern levels depending on whether the sample is aqueous or vitreous. I'm not going to go through the calcium, but the magnesium, notice when it gets down below 0.61 milligrams per deciliter, that's a good indication that that animal was experiencing hypomagnesemia. If we're sampling vitreous humor, then that value is going to be at 1.34. So there is a difference depending on what the sample is. The other thing is that these ocular fluids are not stable for long periods of time, and that's kind of controversial. Some people say 24, some say 48, some say 72, but some good reference out here show that they were stable at room temperature for 48 hours. And the thing that's going on, or what affects the stability, is that if we get bacterial contamination in an ocular fluid sample, those bacteria will actually decrease the magnesium levels. If we happen to get any cells, which can happen especially if we're collecting vitreous humor, iris cells or whatever, there is the intracellular magnesium, which will increase the ocular magnesium levels. So it's important that we try to prevent those two types of contamination. So how do we know if it's past 48 hours? Because if it's after 48 hours, maybe our values aren't really representative of the animal. We know that potassium levels increase about 25% for each 12 hours after death. And those are estimates. They're not set in stone, but pretty good guidelines. And so if they have potassium completed along with the magnesium on the ocular fluid, and that potassium's at 10 or above, then that's a good indication that this animal has been dead for more than 48 hours. And as veterinarians, we know that we don't always know the time of death when we're asked to come out and perform a necropsy. So with that, I'll leave you. Sure would like to have you visit our website, www.ksvdl.org, or the QR code there. That's a direct link to our newsletter page. Our current newsletter page actually has an article that explains hypomagnesemia and hypocalcemia in more detail. With that, I'll leave you. Thank you.